peut vivre avec bon problème orthopédique, pareil nous dit en anglais, ça veut dire bon problème les os, pareil sur spondylosis, sur problème genou, tout ça là nous pour aborder aujourd'hui dans Topik Konversasyon avec Dr. Himanshu Gupta qui est là le plateau pour nous faire une conversation, le s'assiser. En effet, Dr. Gupta, il pas nouveau, le plateau bonjour c'est tous les l'année, il vient rendre nous sa visite et sa voyage pour cesser entre aujourd'hui, commencement aujourd'hui le 1er décembre jusqu'à le 6 décembre. Alors, faisons confortable pour nous adresser un petit peu sa bonne situation. Nouveau facilité aussi, Code Victoria Health Clinic, tout ça là pour pégayer aborder dans notre topic conversation la bon matin. Welcome back to Seychelles, Dr. Gupta.
Thank you. Thank
How
you very
are
much.
you?
I'm good, very good.
And since when have you came to Seychelles?
I just landed yesterday to Seychelles, and this is my 5th visit, and really liking to work here, liking the people here and the type of hospitality that we receive here, which brings me back again and again. But also my professional responsibilities in terms of treating the patients of their pain, be it knee, neck, back, and hip joints and other issues. So we are trying to treat them as well and with the latest techniques as possible.
And for the viewers this morning who may have heard of you for the first time, can you give us an overview of your background and what kind of orthopedic surgery you do?
So I've been trained in India, and following that I've been doing my fellowships, which I've done an interventional spine fellowship in US. Then I did my fellowship in endoscopic or minimally invasive spine surgery in Korea. Then I did a knee replacement or joint replacement fellowship in India. Following which, till date, I have done about more than 3,600 knee replacements, and currently what we are doing right now is majorly we are trying to use computer navigation and minimally invasive techniques, wherein with the help of a computer navigation system we are able to do the best of international techniques, getting the patients to walk on the next day of surgery. They do not need to be long time bedridden. For spine, we are doing endoscopic spine surgery without doing the need for a big surgery or opening up the whole spine, and they're made to walk and stand from the same day itself, and that's how they can join back work. They can be at their activities, enjoy life the way they want to be in a pretty early rehabilitation, and everything is achieved. So compared to the previous times, from 2 months, now we have brought it down to 2 weeks, when the patients are able to do almost all their activities.
So the rehabilitation program after surgery is going well so far, especially when it comes to the knee replacement surgeries?
Yeah, so I mean, if I talk about Seychelles, in Seychelles itself we have done about close to 10 knee replacement surgeries, and we are very happy to say that almost all patients are doing very well. They are coming follow-ups, they are walking well, they are exercising well. Some of them were overweight. They have also actually benefited from the surgery because they've started to walk around a little bit extra, doing all their activities, and because it usually happens at the old age, so we see that these patients have actually gone into they've got a little bit of a confidence back in their normal daily routine. They used to be dependent on their children or somebody to help them out or to take them to the supermarket. Now they're driving on their own and going to the markets and doing their stuff. So they have got a dignity to their elderly life. So that is something which makes us happy when we hear from the patients that they now feel confident, they get dignity, they feel respected because they're not requiring any help. So that's how it is working.
And now you're in Seychelles from today, Monday the 1st
From today till
6th,
Sunday I'll be here.
6th December. Perhaps what type of cases are you considering of that people can come forward for consultation?
Patients suffering from any types of joint pains, especially knee pain or hip pain, which is not resolving, which is in an advanced stage of arthritis or damage, when they are walking with bow legs, knock knees, or unable to walk a long distance. Those are the patients wherein a surgery is something which will be helpful. But even if they are not at that stage of surgery, we can still look at doing some injections and viscosupplementation techniques for the knee. As far as the spine is concerned, there are many people who suffer from sciatica, where they have a pain which goes all the way down into the leg, starting from the back. And they are the ones which we have been able to treat pretty well with minimally invasive and laser techniques for in a way we shrink the disc that relieves the pressure on the nerve. Once that is achieved, the patient's recovery is hastened up with just basically exercises and physiotherapy.
And I have also heard some exciting news that we are going to have the first private clinic in Seychelles to have an MRI facility.
Yeah.
Can you give us some information about
So
that?
I'll touch upon it. So when we started this project with the Victoria Health Clinic, we were discussing a lot of things, and at that time it came to the fore in our discussions that there is no MRI facility available in the private setup for the patients, and usually at the government setup, even though it is a good facility, but the long waiting list is there, and many of the patients were actually not given timely dates. They were not being able to be taken care of because of the fact that they had a lot of other patients as well in the waiting list. So that's why we decided to put it up. It has come up very well. It has come up in a beautiful way, and we have the first open system of MRI in Seychelles. We have the system wherein the patients will not feel claustrophobic, will not feel closed up. Secondly, in terms of the technology, we have the latest coils and MRI facilities in which takes care of all the body parts differently. And most important part in medicine is usually early diagnosis, because if you have been able to diagnose a condition early, you will be able to treat it well, because for each disease there is a staging, there is a grading as to how advanced or how early is a disease. And in most cases, when we talk about probably a knee injury, which is probably we talk about a spine problem, a neck problem, cervical problem causing issues, if you are able to diagnose them early by doing MRI, you are able to treat them well without possibly the need of surgery as well in many cases. And same time, I have seen patients in Seychelles who have been actually, I saw them in my first visit last year, saw them, we advised them MRI, they were not able to get it done. Then when they came to us in my this visit in June, it had become pretty severe by that time, because over the period of time the degeneration, the process of the disease keeps on going ahead, and they are not guided well. And once they came to us in June, obviously we intervened, we made them fine, we treated the disc with laser. They did well, but it's just that they had extra 6 months of suffering, taking break from work, not being able to concentrate on their life, and most importantly taking medication when it was not necessary. They were just trying to subdue the symptoms with pain medicines and analgesics rather than taking the actual treatment. So that's where the role of MRI across the world is very, very aggressive in terms of diagnosing it in time, and in actual you should be very, very fast in diagnosing. And that's where private MRI will be helpful, because the patients can actually get their time, they can take their appointments, and they can come over for the facility. It is fully functional right now. We will be having a formal inauguration as well by His Excellency in this week itself, and we would like to have this MRI open to the public in terms of having as many patients that we can help come over and get it done without any problems. And we have in a way we kept it very, very the costing has been kept very low, because we want to help the patients in terms of getting it done and not being turned away by the costing part.
And will the appointments strictly by booking, or patients can walk into the clinic?
Most of the times it is by booking, so that they don't have to wait. But if there is an emergency and everything, we can still take the patients on a walk-in emergency basis, yes.
Perhaps you mentioned that you came in June. For the patients that you have seen back then, do you do some kind of follow-up to see how their conditions has improved?
Almost all patients that we see in our visits, we call them and we have a regular follow-up system, wherein they are either, if they have been given some exercises, then they are followed up by our doctors. If they have been given some physiotherapy, they are followed up by a physiotherapy and rehabilitation team. If they have been operated upon or some surgery has been done, then again our doctors are here. They follow up the patients, and we do every fortnightly we do video calls with our patients, video consultations when even I'm not here. We see them recovering well, and if there is some sort of a deficit somewhere, no, we should add this, we should add this, just for the patient's comfort, so that we can give them the best of results.
Yeah. And perhaps for new patients, do they have to bring the past medical informations like the
Absolutely.
x-rays and all that?
Always necessary, ma'am, to bring and carry all their previous investigations, to carry their previous records, and if they're taking any medications for anything, they should be bringing it along, so that when we are treating them, we have everything in mind and we take care of the best treatment which can be given without causing any collateral damage or any side effects.
And in that short period of time that you are going to be in Seychelles, will you have time to perform surgeries or only consultations?
No, ma'am, I'll be doing some surgeries. There are some surgery which have been planned from last time as well.
Okay.
So we'll be doing them. So we have about, I think, 2-3 knee replacement surgeries for now. We have a few spine interventions. We have a few cervical interventions to be done, and we'll be doing them.
And the recovery period perhaps after surgery?
For most of the spine interventions, they are allowed to go home next day itself.
Okay.
And for usually a knee replacement surgery, patients are here for about in the clinic for about 2 to 3 days. And for a sports injury or a meniscus or arthroscopy for the knee, usually the patient discharged the same day or the next day. And these are the type of cases that we typically encounter a lot in orthopedic practice. Yes, another thing which is building up, which is growing in pretty significantly, is the shoulder pains.
Okay.
I think that has got to do with the fact that the way they sometimes are majorly using mobile or on the laptop and they're sitting for long hours, the shoulder gets jammed, gets a little stiff, and then when they start doing some exercise, they tear the shoulder capsule ligaments inside. So that is also that we have started now. So we'll be doing some shoulder surgeries and repairs as well.
And nowadays we are seeing a lot of people suffering from back spine due to, like you've mentioned, heavy use of mobile phones, stress, or bad posture. Perhaps what advice do you have for these people, especially in terms of maintaining a good posture to minimize the impact?
See, there's usually a rule which is called as a 40-20 rule. So when we look at it, even in schools when you were going, you used to have a particular class or a particular period for about 35-40 minutes. That's because that is the time wherein the kids or even adults will have the concentration time of 30 minutes to 40 minutes for any activity, and beyond that they need to take a small break. So even if they take a break after 35 to 40 minutes or 5 minutes, just walk around the office, just stretch it around, and then again come back and sit and work. Make sure that when they're sitting, the laptop level should be at the same level as the eye. They should not be sunk into the seat while they're sitting, on which they're sitting. They should be well supported. They should not be slouching forwards. These are activities which actually avoid any repetitive stress injuries onto your spine, onto your lower back, your neck, everything. But what we are actually seeing is a lot of patients getting a curve developing in the back because of the sitting postures and sitting all days and working on the mobiles, which never used to be in the previous generation. So it is all a part of our, I would say, expense of development. So I mean, where the people are developing, they're actually going more and more into mobiles and digital things, and they're getting more into a bad posture. So it is very important to do these things while you're working. Stretching around every day in the morning, exercising daily for about 15 to 20 minutes of walk or some cardio exercise, and 15-20 minutes of body stretching. Very important for almost everybody.
And then there are some who does a lot of heavy lifting and bending, which also develops some spine
so
problems.
some people who are professionally into a situation wherein they have to bend down and lift things, heavy laborers, workers, for them it is very important to keep their lower back strong. So they should be doing more of lower back strengthening exercises. Even if they want, they can do some gymming to sort of get the strength in the lower back. Plus keep the posture of lifting things good. You should be bending more at the knees rather than bending at the back. So there's a 90 and the straight angle which changes. Once that changes, also it tends to avoid any further injuries in the back. And obviously everybody knows his or her capacity. He should be lifting as much as he can, or take some people's or some other person's help when if it is a heavy thing. That's the ideal way.
And then there are the pain management that we do at home. For example, I have a back pain. I go to the pharmacy. I buy an over-the-counter pain relief medicine such as the Voltaren gel and the Move. How effective are these medicines in terms of orthopedic issues?
So in terms of a scientific reply to this, I would say about 90% people in their lifetime will have back pain some or the other time. But most of these back pains are self-limiting. They are muscular. Once the patient rests, he'll get better. So when you apply some heat therapy in the back, or you apply some these Voltaren gels and everything, the way it works is it gives some relief locally, plus it generates some heat, plus it has a action wherein it deflects the mind of the pain. You concentrate more on the burning that the gel is producing.
Yeah.
It is a counter irritant. So that's something which works in that sense. The symptoms of the muscle tends to improve by its own in 2 to 3 days time. So most of these back pains are self-limiting. Only when it is excruciating or it has associated sciatica, it is spreading up and down the spine and everything, then you should be meeting a doctor immediately. Otherwise, you should give a back pain 2 to 3 days time. With your rest and heat therapy, it should improve. If it is not improving, then you should definitely be meeting a doctor or a specialist to find out the actual reason behind it. And if you think that this back pain has been made by your activity of bending or lifting or doing some activity, then you should be meeting the doctor immediately, because you might be having a disc issue.
And then we have some other non-invasive treatments, such as the support of a the lumbar belt. How useful is that, and how harmful is it?
Very good question. Most people think that wearing a belt is a very good option, but unfortunately, for an acute situation, suppose I have to come to your studio today and I have a back pain, I can wear it today. But if I keep on wearing it on a regular basis daily, it's going to cause my back muscles to become weak.
Okay.
And then I would not be able to live without a belt after 6 months of its use. And there are many patients who have been actually operated for their spine problem. They've been made better, but still they are not able to give up the belt because their muscle strength is not there. So you should not be wearing the lumbar belt or any of these things like a knee support or a knee cap or a neck collar for a long time. It is only for acute condition. You have to give relief for a few days, and that time you have some important work to be done. Then you can wear it. Otherwise, regularly, long term, you should not wear it.
And doctor, perhaps beyond the consultations and your surgeries in Seychelles, what has been one of your core mission to, with your collaboration with the Victoria Health Clinics beyond orthopedic care?
So when we started with Victoria Health Clinic, there was a lot of potential in the clinic, as well as the way it was being managed was very well. We wanted to add some specific things into it, wherein we have upgraded the surgery level in terms of doing minimally invasive surgeries for spine or knees and shoulders. That's part of the orthopedics. Then we looked at adding new facilities like doing an MRI. Probably going forwards, we might add more services as well. And thirdly, the major killer, which is there, the second most common killer around the world right now, is cancer. First is cardiovascular, second is cancer. And we are looking at promoting and adding a cancer specialty to our clinic. Most patients from Seychelles unfortunately travel outside the country, which we want to sort of somewhere contribute by preserving their the economy of the country going outside. So we can actually have the patients being treated locally, and we have an oncologist who is coming on a regular basis, and we're going to have him soon here again. I think this week itself he's coming. We'll be doing some consultations, and going forwards, if everything is in place, we'll look at starting to do some cancer curative therapies, some advanced cancer treatments, bone marrow transplants. A lot of things are there to be done for cancer, which needs to be done, and patients are actually suffering because of the fact that they have heavy bills to pay. They are traveling outside the country for this. Sometimes they get delayed at the hospital also getting their treatments done. So for them, we want to sort of start off this wing. So that is our next mission in terms of including oncology and starting it aggressively into the country.
Nous continuons nos Topik Konversasyon avec Dr. Himanshu Gupta, qui ici c'est le commencement 11h jusqu'à le 6 décembre, quand vous pouvez voir patient qui a un bon problème orthopédique, par mon annoncé plus bonheur. Victoria Health Clinic aussi, il y a différentes facilités pour aider avec bon traitement, surtout le côté spondylosis, scatia, bon problème les os. Alors, nous continuons Topik Konversasyon. Doctor, I had a question from one of our viewers. She was asking, let me check just a minute, in regards to spondylosis. Okay, the lady said, very good morning to you, doctor. My question is, how risky for a spondylosis surgery, and if the patient can walk again or there is a risk for them to be paralyzed?
Okay. So first and foremost, we need to understand spondylosis by definition is just a degeneration of the spine. So when you are gradually gaining your age, you're going up in age, you will have degeneration even in a normal person. Now when that spondylosis is actually involving a nerve and it is causing compression on the nerve, that is what is called as a lumbar spondylosis or a cervical spondylosis, causing compression on the nerve. Most of these surgeries or interventions that we do are very, very safe. There is no chances of paralysis for the patient. The patient can be made to be active and walking from the same day onwards. And whatever the advanced techniques required for this is there, the equipments which are there, the microscope system that we use for these surgeries, which make sure that you're not touching any nerve, that is all available with us at Victoria when we're doing these surgeries. And that's where the chances of paralysis, injury, cutting, damage are almost negligible, absolutely nothing. And across the world these days, the chances of these surgeries leading to a nerve injury is less than 1% because of the advent of technology and the equipments that we have.
And for somebody who perhaps is suffering from a curved spinal cord, what are the possibilities for it to be strengthened? Do we have to do some invasive surgeries, or as I've mentioned, we rely on the lumbar belt for that?
Okay. So there are two types of curves in the spine. The kyphosis, which is bent this way, and scoliosis, which is curved. Now in most of these, if it is something which is structural, wherein the bones were forming, and at that stage the patient has got a little bit of a curve, and it is beyond the permissible limit which is causing a compression on the spine or the patient's activities or movements, then definitely you need a surgical correction. But most of them fall into the category of less than 15 to 20 degree of curve, and that can be actually corrected by doing some exercises and posture corrections. Once you are regularly doing posture corrections, you would be able to achieve it. So the first thing was structural, the second is postural abnormality. Posture abnormalities, when the spine is straight, the curve has developed because of our weak muscles or because of a bad posture of sitting. I mean, I have seen a banker recently in another country wherein they used to work like this because the laptop used to be this and the customer used to be here. They have developed a curve in the spine because of the angle of working like this for 15-18 years. And now we have told them some exercises and corrections and physiotherapy. It's going to take a little bit a longer time, but they will improve. So first and foremost, you have to avoid the stimulus which is causing the compression or the abnormal rotation in the spine, and then you have to correct it by doing exercises. So once you do that, you are able to correct it.
And perhaps in Seychelles, in your own experiences, since you've come to Seychelles and have done some surgeries, what would you say are the diagnosis of some of the cases that you have identified? Is it due to bad posture or structural issues? Like
the most common thing is because of bad postures, and even for students, unfortunately, we have seen then that they're sitting wrongly and they're studying, which has led to a few patients having a disc problem in the spine. We have actually treated one girl who was only 19 because of this disc issue. I think it's got to do with the posture, the way of sitting and working, the way of actually being not too active, so to say. And I would like to again say that most important thing is exercise, strengthening on a regular basis, having a good balanced diet to have a good muscle strength, and trying to keep your postures straight. The more you are straight, the better it is to avoid any further problems. Even for some middle-aged people, we are seeing knee arthritis developing early. That's because of another condition which I see pretty commonly in Seychelles, which is obesity. So when you have too much of a weight issue, when you have too much of a obesity issue, that causes too much extra weight onto the hips and the knees. That's going to cause early degeneration. So even for that, we are running a pretty aggressive weight loss program in our clinic, and that has given us fantabulous results in terms of getting the patients ready for surgery with lesser weight, so they are able to rehabilitate well after surgery, start walking early when the weight is less. And in a way, I mean, it is a multidisciplinary, multimodal approach that we take towards patients to get them back to normalcy, and that's the beautiful part of it. So there are different people, different teams which come together, like the physician, we as orthopedic surgeons, the weight loss management program, doctors, everybody works together to sort of get the patients back to the normal life as soon as possible.
Alors, c'est pas oublier téléspectateurs, par exemple, entendre maintenir une bonne façon assise, un bon posture, il est important pour vous éviter que vous gagnez ça bon problème les dos à cause de la plupart bon cas qui peut détecter ici c'est à cause nous n'a pas un bon posture et pas oublier docteur pour là entre lundi le 1er aujourd'hui jusqu'à le 6 décembre pour vous qui ont envie à faire bonne consultation docteur pour aussi d'un pays que il peut faire un peu bonne l'opération alors se contacter Victoria Health Clinic et booker votre appointment à cause docteur pour sa semaine. And doctor, we continue with our conversation. I still have a few questions from the viewers. I have Jano who says, good morning. Ask doctor if they do endoscopy spine relief operation.
Yes, we do. And that's something which we started doing in Seychelles only last time. And the reason was that we were not able to again get the patients with the MRI. The patients were coming to us, they had a sciatica problem, they had a lumbar problem, but we were not able to diagnose them. So once the MRI started now, we'll be doing more of endoscopic surgeries because we will be able to have a good diagnosis. And if the patient already has an MRI, they can always visit us, see us. We are doing all sort of endoscopic spine surgeries like interlaminar, transforaminal. Both of them are required for the approach towards removing the disc, which can be central or it can be on the side. So based on that, we will be able to treat it. We are doing them.
And that person says that he has been a patient who is living with spine problem for 12 years.
So, I mean, not all candidates are good for endoscopic spine surgery. We need to first assess the patient, look at because when you're doing endoscopic spine, you're not doing any drilling, you're not doing any cutting. You just put in a camera and you remove the fragment of the disc and remove the compression on the nerve. If somebody is suffering from 10-12 years, they get a lot of calcification, hardening of the tissues, they get a lot of tightening of the canal from where the endoscope can go in. So we need to first assess the patient. If he's the right candidate, definitely we can treat him with endoscopic spine.
And perhaps, doctor, when do you decide that this is the right time to perform surgeries in such conditions?
So there are 4 things. First and foremost, if there is neurological involvement where the nerve is getting compressed and is sequentially increasing. Secondly, if the pain is not resolving and the patient is now on regular medications for pain to control the symptoms. Thirdly, very important, if the patient is having loss of strength or loss of power in the muscles because of the nerve being compressed. And obviously, fourthly, if it is something which is impacting his quality of life, he's not able to work, he's not able to sit, he's not able to concentrate on his activities. At that time, we intervene and try to make it better.
And I have somebody else who says that she's suffering from spondylosis. She's also a caregiver working with somebody who is bedridden, and she has to do a lot of heavy lifting and bending. You know how these things work.
Yes.
She has tried acupuncture as well, but nothing is helping. Perhaps an advice in that condition?
First and foremost, we would like to see if it is spondylosis, as I said, it's a very, very big topic. We need to first see if it is just causing back pain or it is causing any leg pains also, it is causing numbness, tingling also, or it is causing weakness also. Based on these criteria, then we can actually recommend her as to what she should not be doing, what she should be doing, and whatever she is doing, what is the modification in that she can do. And then we can advise her.
Another message, doctor, especially about the bad posture issues for the office workers. Somebody says for the office workers, most of them don't have a choice when it comes to proper chairs that will allow them to sit comfortably. And most people spend long hours using their computers. And perhaps what kind of investments can they make? You know, these days we have the ergonomics chairs and all that. A little advice for them.
What they can do is basically make sure that either their laptop is lifted up so that their neck is not at pressure. So how they can achieve that is by putting in a small laptop stand or a small platform on which they can keep the laptop and avoid any extra pressure onto the neck. In terms of the back, they can put a small cushion or a support behind the back, so it is going to keep it straight. They're not going to bend forwards. Make sure that while they are sitting, their hips and knees should be at 90-90.
Okay.
Make sure that their eye level is pretty well balanced with the laptop center. And also very important that they should keep the brightness adjusted for the laptop, because that is where again they start having eye issues and headache and this problem. Last but not the least, as I told, every 40-45 minutes you have to get up, move around and stretch around. Very
Take a
important.
little break every once in a while.
Just walk to the water cooler, have a glass of water, come back and sit again, start working, then again go and meet your colleague after 40 minutes, see what they are doing, meet your partners and come back. So things like that will have to be done and incorporated into your lifestyle, because that's how you're going to be. In an office setup you have to be sitting, so that's where you can invest. Plus, when you are at home in the morning time or in the evening time, find out some 15-20 minutes for your back exercises and strengthening. Around the weekends, look at doing some swimming and exercises, again very good for neck and back strengthening muscles.
Yeah. And perhaps, doctor, what do you hope to achieve in the Seychelles community through your visits in collaboration with Victoria Health Clinic?
First thing we have started to achieve is that the patients have actually started to get better with knee replacement surgery. Not that they were not getting better earlier, it's just that their fear is now being taken control of. They have become independent, they have started walking earlier and faster compared to what they used to do earlier. Secondly, we wanted to achieve early diagnosis plan, which we have achieved in terms of getting an MRI installed and working well for the patients. Thirdly, we want to encourage more and more of patients to sort of get themselves diagnosed at time, even for ones suffering from cancer, so they can actually see the oncologist. We have a whole array of blood investigations that we run, and x-rays, MRI and everything which we can be run together to find out if the patient is suffering from any oncological or cancer issues. If that is there, we need to treat it, and for that itself we are now having the oncologists regularly visit the place, oncosurgeons regularly visit the place, and that's what we are trying to achieve for now. Going forwards, the plan is, if we look at right now in the country, there is no PET CT, there is no way of diagnosing patients suffering from multiple level cancers or metastasis, and that's something for which they have to travel outside the country to multiple places. So going forwards, if everything is in place, we can even look at putting up a PET CT in collaboration with the government or individually, and work at helping and taking the cancer treatment to a next level.
And perhaps, doctor, since you began your services in the Seychelles, how would you rate the success of all the interventions that you have gone through?
I would like to put it as 11 on 10 because of the type of support that we have received from the local partner at Victoria Health Clinic, from the people themselves. They have been very welcoming. They have been very, very open to the concept of a newer technique for knee replacement, wherein when we started doing it, we told them that it is computer navigation. They were all scared as if it is robotic. And we had to actually explain them that we will be doing the surgery, it is just the computer navigation. It helps you to assess as to how much of the surgery and how much of the bone has to be shaved off. We don't remove too much bone, all that. And then they gradually started accepting it, and they started improving. And that's what gives you confidence to do more and more for the people when they are so welcoming and so helpful, and they're pretty aware about their health problems, which is contrary to many other African countries where also we are working. And we started with Mauritius, we are in Seychelles, we have actually got into a big hospital we are making in Zanzibar. Then we are expanding into Ethiopia and Rwanda. So I mean, all these places we are moving fast towards the patient's benefit only, and we hope to sort of achieve the best of care in Seychelles as well.
And when do you plan to come back next time after this visit?
After 2 months?
Every 2 months?
Yeah, every 2.5 months I'm here. Every 8 to 10 weeks I come here.
And when you leave here today, what's your first task on your to-do list? Surgery?
On my to-do list to have a coffee, and then we start with the consultations.
Okay, and doctor, thank you for joining us.
Thank you very much, ma'am, for having us, and it's always a pleasure being on your show.
And
really
perhaps last message for our viewers to come down for a consultation.
If they have any problems, or they know of anybody who has been suffering and who has been having issues in terms of knees, backs, spine, and you want to give them something for the new year, a healthy
Christmas
new year
gift.
ahead, then you can actually send them across to Victoria Health Clinic, and I'm available daily there from morning 8 a.m. till evening 5. You can make an appointment, or you can even walk in. You can see the patients, and we'll be doing the consultations until Friday.
Okay. Thank you very much,
Thank you very
Doctor,
much,
for
ma'am.
joining us, and all the best for your upcoming tasks and surgeries as well.
Thank you very much. Really appreciate it.
Welcome.
Have a good day.
Ça, c'est notre Topik Konversasyon que nous t'y assise avec Dr. Himanshu Gupta, qui descend Cécile en collaboration avec Victoria Health Clinic, descend pour ou qui peut souffrir avec un bon problème les dos, bon problème spondylosis, scatia, et pareil, il y en a une mentionné 12 ans, ou peut vivre avec sa douleur les dos, on connaît hyper facile. Alors, Dr. Himanshu Gupta, il pour que Victoria Health Clinic from aujourd'hui, lundi le 1er jusqu'à le 6 décembre, zot capable walk-in, zot capable call pour booker un appointment avec lui aussi. Alors, saisis ça l'opportunité, c'est parler sur docteur aller, mais c'est tout de même, il pourrait tourner l'année prochaine encore de des mois pour lui continuer son bonne consultation qui peut faire. Et nous, de nous côté, nous continuons avec la reste du programme de Bozou Cécile.